I'd like to present the findings of the Lancet Oncology Commission on sustainable care for children with cancer that involve collaborators in more than 30 countries.
Cancer is now one of the main causes of death globally, also in low and middle income countries. The urgency of articulating a global response was reflected in the Resolution 7012 of the World Health Assembly in May of 2017, urging governments to take action in cancer prevention and control in the context of multidisciplinary and integrated care. Strengthening the health systems worldwide has also resulted in a marked decrease in under 5 mortality rates and overall improvement in child health outcomes. As competing causes of death decline in children, the burden of childhood cancer will continue to increase, reflecting a new epidemiological transition that is critical for understanding and planning childhood cancer care and control. Thus, there is an imperative to address childhood cancer care at a global level.
We developed a global childhood cancer microsimulation model to estimate incidence, survival, and deaths for children in 2020 and projected this to 2050. We also costed cancer services. We estimated the scaling up services, how much this would cost around the world. Then we estimated the health and economic benefits of scaling up health services to improve cancer care for children, to reduce death, and we estimated the benefits in economic terms for investments that were made. We're able to show that in 2020, there were 413,000 cases of childhood cancer. Out of these, 200,000 were missed. Between 2020 and 2050, we estimated that there would be 13.7 million new cases of childhood cancer. Out of these, 6.1 million cases will be missed with the current level of service provision. We were able to show huge variation in 5-year net survival, especially very low levels in sub-Saharan Africa and in Southeast Asia. As a result, we're able to project that there would be 11.1 million deaths between 2020 and 2050 if we continued with the current levels of service provision around the world. Most of these deaths would occur in low and middle income countries. But if we're able to scale up access to diagnosis, treatment, reduce abandonment, improve quality, and bring all of these interventions together, there would be huge benefits. We'll be able to improve survival and reduce the number of deaths around the world, especially in low and middle income countries. The cost of scale-up would be $20 billion each year for the period 2020 to 2050. This investment would lead to $2 trillion of return, a remarkable number, in addition to the health benefits that one would realize. $3 of return for every dollar invested. So there's a compelling case for investing in services for improving care for children with cancer around the world.
So as we have seen, there is a compelling case for investing in childhood cancer, addressing diagnosis, treatment, and comprehensive care. And for this purpose, the Commission explored pathways to scale up with service delivery models that would provide comprehensive childhood cancer care, addressing diagnosis and treatment within the national health systems. Using a modified Delphi methodology, the Commission proposes a model of country roadmaps and facility tiers for the development and implementation of childhood cancer care. So the Delphi study also helped define the essential care packages for prioritization at a national level to provide sustainable pediatric cancer care with integration within the country roadmaps and the facility tiers. Defining care packages is critical at a national level as it allows for prioritization of resources and to provide effective care. These sustainable pediatric cancer packages, which in the Commission we call super packages, considered 4 intervention pathways: diagnosis, treatment, treatment completion, and integrated care.
So what needs to be done? We need a strong global and national leadership. We need an inclusive global coalition that involves private sector, public sector, civil society, affected communities to take this case forward. We need investment, but we also need to align this investment with universal health coverage and sustainable development goals. And we need innovation to ensure every child with cancer that needs access to cancer care and services is able to access these services to prevent needless deaths around the world.